COVID-19, or coronavirus infectious disease 2019, is a virus. It's a coronavirus. We have coronaviruses here in the United States now, which cause respiratory illness. This is a novel coronavirus, which has come out of Wuhan, China, and spread across the world. So the symptoms of COVID-19 is predominantly fever and cough. It's an infection of the respiratory system, so fever, cough, some people have shortness of breath as well. If you're a patient and you think you have COVID-19, the first thing to do is isolate yourself at home. If you have mild to moderate symptoms, this is going to go away on its own, and your biggest responsibility is not giving it to other people. The decision on whether or not to come to an emergency room is based on how sick you are. Obviously, if you feel awful, you're having trouble breathing, you should go to the emergency room. You should call ahead so they know you're coming, so they can take the proper precautions. But if you just have mild symptoms, cough, a little bit of fever, then just call your family doctor, your local doctor, and get advice. The best way to prevent the disease right now is avoiding people who are sick. There's no vaccine, there's no specific treatment, so you need to avoid people who are sick. In addition, when you're out in public, wash your hands frequently. Certainly when you come back into your house, wash your hands. We don't think it's a good idea to wear a mask in public all the time. Doing that diverts those masks from the healthcare providers who need the masks, and also wearing the mask all day, they get saturated, they don't work as well, and so it's not recommended. What we're seeing so far is that the children seem to do very well. Most people do well, but the elderly, those over 80, and those with underlying health conditions have a worse outcome with this infection. The immune system seems to falter as you get older, and we see this with other conditions such as influenza. MedStar has been preparing for this ever since December when it first came out. It's been a steady progression of plans to include educating people about it, plans for isolating people when they come to our facility, and then plans for protecting our workers who care for these patients. So if you get the disease now, you would need to be quarantined. Again, the big teaching point with this virus is not spreading it to others because there's no treatment. And so if you have it, we want you to self-quarantine at home until you're better. The decision on whether you're quarantined at home or in the hospital is really made by the clinical condition. If you need something from the hospital, oxygen, other things, then we want you in the hospital to take care of you. But if you don't need anything that a hospital can offer, then you're better off staying home and caring for yourself at home. Based on the data out of China, it seems that most people get sick by day 5. So after exposure until you get sick is about 5 days. The CDC estimates if they push that out to 14 days, they'll catch anybody who might develop symptoms later. And if you haven't developed symptoms after 14 days, then you didn't catch the virus. The question about whether or not you can get it twice is unknown. We don't think so. With other coronaviruses, there's a period of immunity. So you catch it, your body builds up an immune response, and then you're immune to it. For this virus, the data's too young to really make firm decisions, but we think you will be immune to it for a period of time. When this will end is unknown. With SARS, it just went away. After a few months, it just disappeared. We don't know if that's going to happen with this virus. It'd be wonderful if it did, but I think we need to prepare for this to be a long slog where it stays around until most people become immune to it or we develop a vaccine.